Welcome to this C3 Collaborating for Health webinar for nurses and HCPs on mental health, which has very kindly been sponsored by Pfizer. Whatever role you work in as a nurse or an HCP, the mental health of your patients will be a dynamic that you have to address. Patients are presenting with more and more comorbidity between mental health problems and physical health problems, and all frontline care staff need to be prepared for and comfortable with this dimension of most clinical interventions. Sustaining mental health, good mental health, is also a very real and personal issue for nurses themselves. Being a nurse or an HCP is stressful and challenging, and mental health conditions are a major contributor to NHS staff sickness. And we'll be hearing tonight during the webinar that they're not being identified early enough and treated properly in the system. We hope to help you work through the importance of these issues for your nursing practice tonight, and also maybe even use the issue as one of the reflective practice examples in your next NMC revalidation. After we've heard from our speakers this evening, there's going to be the opportunity to take questions from you, and the instructions for lodging questions for the panel will come up on your screens in due course. I'd like to introduce you now to our panel members who are with us this evening, and we have an absolutely splendid panel of speakers this evening. Our first panel member sitting on my left is Steve Borman. Welcome, Steve. Steve is the Director of Employee Health at Empactis, and we're very, very pleased to have you here, Steve. Our next panel member is Catherine Gamble. Catherine is the Royal College of Nursing Mental Health Advisor. Welcome, Catherine.
Thank you.
Sitting next to Catherine is Yvonne Coghill. Yvonne is the Director of the Workforce Race Equality Standard at NHS England. And since the 1st of January, Yvonne has also been the Deputy President of the Royal College of Nursing. We're very pleased to have you here this evening, Yvonne. Our next panel member is Jocelyn Cornwall, who is the Chief Executive of the Point of Care Foundation. Welcome, Jocelyn. And lastly, I'd like to welcome Michaela Nuttall, who also works with me here at C3, where Michaela is the C3 Advisor in Nursing.
Thank you, Tom.
Thank you all for joining us on the panel tonight. Very, very pleased to have you here. Steve, if we can start with you. A decade ago, and it seems amazing to think that it's 10 years ago now, in your seminal NHS Health and Wellbeing review, you concluded that mental health conditions were a major contributor to NHS staff sickness, and that they weren't being tackled early enough. You called for the NHS workplace to be a primary site for mental health promotion and prevention. And you suggested that that was a fundamental productivity cornerstone of any modern health service. Can you explain to us your rationale and describe the part that nurses and healthcare assistants can play in the delivery of your ambition for what you hope the NHS would do in this area?
Well, thank you, Tom, and thank you for the opportunity to take part this evening. It was a real privilege back in 2009 to go and speak to literally hundreds of NHS staff about their work, about what they did, about how they did it, and the conditions that they were actually working under. And actually, it wasn't that difficult to show very clearly that there's a hugely strong association between good staff health, better patient outcomes, better performance against regulatory targets, and organisational efficiency. And that was the simple conclusion of the review. And I'm afraid the staff are both part of the solution, but also part of the problem. Because one of the issues that we found is that particularly nurses were extremely dedicated to the care of their patients. They often didn't recognise that their own health did directly impact, and they were very reluctant to take time off sick because they felt that the care of their patients would actually suffer. There was also clearly stigma. People are very worried about their careers in a caring profession if they actually own up to the fact that they've actually got a problem. And then the other issue was actually awareness. Awareness of the services that were there to actually support them in the first place. So asking very simple questions like where would you go actually if you had an issue? I was surprised that even in trusts that had very good support services in place, actually awareness of how to use them, and quite a significant amount of mistrust in those services at the end of the day. I coined the phrase in the foreword to the review, cobbler's children. I felt that healthcare practitioners were often cobbler's children, and far from getting the best of healthcare when they were ill, they actually went to the back of the queue. And I'm afraid 10 years on, despite some actually very good initiatives that have moved things forward, I think we still have cobbler's children. And that's unacceptable. If we're going to actually deliver the strategic plan for the NHS and transform healthcare and focus on prevention, then nurses, just as Simon Stevens says, should be ambassadors for health. And that's where I'm coming from, Tom. So thank you, C3, for the opportunity to take part tonight.
Thank you, Steve. Catherine, as the RCN Mental Health Advisor, you've been leading the RCN's Parity of Esteem programme, and you advise RCN members on a whole range of mental health issues during the course of your day job. Can you tell us what the RCN's Parity of Esteem programme is trying to achieve, and why this is relevant to nurses and HCPs who may be watching the webinar tonight?
Well, thank you, Tom. I think the first important thing to do is to actually clarify what parity of esteem means. I think there's a need to recognise that it's an equality between physical and mental health, not just in the way that services are provided, but the manner in which nurses respond. I think there is the reason we put the parity of esteem together was that we know as mental health nurses, put a hand on heart, that we aren't doing a good enough job with our clients and our service users, and the people who have lived experience of services are, we know, dying between 15 to 20 years earlier than the general population. For example, if I was diagnosed with cancer tomorrow, I am more likely, because of my standing, my social standing, my experience, where I live, I am much more likely to have a better outcome than somebody who with a serious mental illness. That can actually have a very, it can include many complex reasons, and the reasons are highly variable, but we know it's to do with discrimination, we know diagnostic overshadowing, so somebody may well go and report to a nurse that they feel, I don't feel particularly well, but it's misconstrued as something that is actually something that's they're just a bit peculiar. They don't actually know how to do it, and therefore that we know that this client group also have much lower poor life chances than the rest of the population. We know that they have not just physical health but lifestyle choices. So we are watching people who come in who perhaps are very overweight through the medication that they take. They are taking, smoking more, and yet we have, as nurses, almost decided that that's actually their lot. We haven't challenged what that was about. So why we are running the Parity of Esteem programme is to really highlight what the concerns are. So we were able to, fortunately, in a position to work with the Equally Well UK, and we are part of that collaboration to really start raising awareness of the concerns that members have got. But in the spring of 2018, my colleague Tim Coupland, who has been the project lead for this, we surveyed mental health professional nurses to establish their view on sort of current progress. And they really highlighted the concerns that we've got. They said that we ought to be increased for funding, more funding in both areas. They wanted to have improved training because they have been trained in one or the other, so a dualistic split between, you can train in mental health but you can't necessarily be up to date in physical health. And so there was also, the survey identified that there was identifying areas where access and innovation and physical healthcare, we wanted to make sure that we were starting to shine the light on that. So that's the point where, as I said, we are absolutely keen that we spread the message and we make the RCN a place and a go-to place where people will think, oh, I can go and actually find out a bit more information about how to establish both and be a better practitioner. Because I think if we are holistic practitioners, we really do need to consider our both the physical and mental health. We have missed out on far too many opportunities where we do far too little in either place. So I've also got, fortunately, and I hope we'll have the opportunity to speak about some very good examples where we know across the country where things have been done very significantly, and we've learnt an awful lot, but there is an awful lot more to do. And the long-term plan, although it identifies what we want to do for and work with people with severe mental illness, there's still a tremendous amount to do to address the inequality between actually what people are observing and what they're actually doing to make a difference in physical health care.
Thank you very much, Catherine. Yvonne, if I can move to you. Yvonne, in your equalities role at NHS England and in your equalities role as the RCN's Deputy President, you've been an absolutely wonderful champion for the equalities agenda in our health systems and within the nursing profession. How would you describe the role of nurses and HCPs in making the NHS equitable in terms of how it recognises and responds to all types of health conditions, whether they're physical health conditions or mental health conditions?
Thank you, Tom, and thank you for inviting me here tonight.
It's our pleasure.
It's a really important, I think, issue that we're talking about, and Catherine talked about it incredibly eloquently. Mental health issues and mental health problems in nursing are very real. And in the world that I work in, you have lots of people from lots of different backgrounds who are unable, I think, to access services based on who they are and where they've come from. And what we know is that if you have what we call intersectionality, that is, if you're somebody from a black and minority ethnic background and you're also somebody who is suffering from an illness, mental health illness, or you come from a LGBT background, then for you it's much more difficult to access those services. So the responsibility, the onus is on our nurses to understand all of that and to recognise that we are in place, we are qualified to work with everybody, that we have to deliver services, high quality services, to all of our population, regardless of their background and regardless of who they are and where they've come from. So we have to learn about others and learn about difference and learn about how we as nurses can work with that difference in a way that's going to make the individual that we're working with feel comfortable, feel respected. There's something about dignity, and we all adhere to the NHS Constitution, which actually talks about the fact that we are all here to make sure that every single person receives a high quality service. And as nurses, we have a real responsibility to do that because we are at the front line a lot of the time. We are the first people that come into contact with individuals. And the interesting thing is that we, as black and ethnic minority nurses, we carry a lot of those issues with us, but we're also working with people from black and ethnic minority backgrounds as well as people from other backgrounds who also have mental health issues. So there's something about understanding and knowing the impact of being somebody from a different background as a nurse yourself, and how society impacts on you, and understanding yourself and knowing how to look after and care for yourself. Because obviously if you can't care for yourself, it's very, very difficult to care for others. And it's really important that nurses know that and understand that, and as Catherine quite rightly said, understand and know where they need to go to get the support and help that they need in order to do the jobs that they're doing. And I remember, I mean, I'm a mental health trained nurse myself, and I remember when I was working in mental health many years ago now, the numbers of people from black and ethnic minority backgrounds, because we know that you're more likely to enter a mental health system if you are from a black and ethnic minority background than if you are from a white background. And I think that having people that understand you and know who you are and where you come from is absolutely pivotal. And I would say to all mental health nurses, there's something about you understanding and knowing how to work with difference. It's incredibly important, and I think that many people imagine that one size fits all, and actually it doesn't. And with that intersectionality, it means that you have to treat everybody differently to get the right outcome, the same outcome for those people. And so I believe that nurses, all nurses, need to have a real understanding of not just mental health issues, not just general physical issues, but mental health issues as well, but also about the diversity of people that they're working with and coming into contact with.
Thank you very much. Both you two have spoken very, very elegantly about the issues for patients. Jocelyn, I want to come back to the nursing issue now with you, because as the Chief Executive of the Point of Care Foundation, you've led the Foundation's pioneering work in supporting the capacity of clinical staff to deliver care in challenging clinical contexts, to do all that emotional labour of nursing. Why did you set up the Foundation, and what did you hope to see change in terms of how the NHS supports nurses and healthcare assistants on the mental health challenges of the daily work of frontline staff?
Well, it's a pleasure to be here with such eminent colleagues. Thank you. You said getting away from patients, but actually the reason that we set up the point of care was our primary interest is in patients and their experience of care. But looking at the evidence very early on, more than 10 years ago now, it's very evident that staff experience shapes patients' experience. And so if you're interested in improving patients' experience, you really have to have an equal interest in staff and their well-being. And I think Steve's report demonstrated that very, very well. So that was why we started. In the years since, we've helped over 200 organisations in this country establish Schwartz rounds, which are at least one way of contributing significantly to the well-being of the people who attend them. What I hope to see, what I would like to see is many more people in management and leadership positions, including in clinical leadership positions, appreciating, understanding fully how important it is for staff to feel supported and also to feel safe enough psychologically to talk about distress and difficulty, both difficulty at home but also difficulty at work. I think there is a huge taboo inside healthcare systems everywhere for the staff actually confessing, if you like, to being unwell themselves. And the last staff survey showed that almost 40% of NHS staff say that they were unwell in the last 12 months due to work-related stress. So we know we have a workforce which is phenomenally stressed and in some cases burned out. And I think there's a really important role of organisations and managers, as well as other colleagues actually, to appreciate that and to place much more importance on well-being and how to help people help each other to be well at work in order to do what's right for patients. Through all the Schwartz rounds that I have attended and observed over the years now, I know that given a psychologically safe space in which to talk, people will talk about very deep feelings of anxiety, guilt, fear, anger, joy too at work. But there's very little space given to that in day-to-day life nowadays, and so what I would like to see is much more opportunities for staff to be able to get together, but also to get together with managers when they need to, just to talk about themselves and their experience.
That's great. Could you also just explain to people who are watching the webinar what a Schwartz round is?
So a Schwartz round is it's a forum, it's a meeting that lasts an hour. It's open to all staff, all occupations, all levels, and it's facilitated by people who we train from the organisations themselves to make it a safe place psychologically in which staff can talk and listen to each other, sharing stories about feelings at work and the nature of the work that they do, and how they feel about it. And there's now a great deal of evidence that just that, being able to sit and talk once a month with colleagues, in albeit a specially facilitated environment, makes people feel more appreciated, makes them feel they understand their colleagues better, makes them feel less isolated. Actually also helps to restore their empathy with patients and returns them to their original motivation of why they wanted to be caregivers in the first place.
That's great. Thank you very much, Jocelyn. Michaela, welcome. Lovely to see you here tonight.
Thank you.
Michaela, as a nurse, what do you see are the opportunities for nurses and HCPs in the community and in other care settings? What do you see as the opportunities for them to respond to the mental health needs of patients alongside treating their physical conditions? Can you talk us through what you think that involves?
Yeah, absolutely. And like everybody said, thank you for inviting us here tonight to come and talk to them on this really important issue. For me, nurses have always been very holistic. We've always wanted to treat the whole person and care for the whole person. But as I think it's already been mentioned, we've gone down these different silos of I'm an adult nurse, I'm a mental health nurse, and it's the challenges is to see where that fits. Now my background's cardiovascular nursing, and we know quite clearly that actually the peak time for developing depression is about 6 weeks after you've had your heart attack, after you've been discharged. Now we know that, but are we really doing as much as we can about it? So I think there's somewhere out there where we need to join up a little bit, which I think is what has already been said. But also I think some of the ways that we can give advice to patients and help and treat patients, as it were, is using things that would benefit both the physical and the mental health of our patients, our population and ourselves. So for example, something like physical activity, which is definitely something at C3 we would promote. You know, the stuff for physical activity, what it will do for your blood pressure is amazing, but what it will do for your mental health is amazing. And so it's these simple things, hard to do, but simple things that actually I think would have this double benefit at least in helping our patients. So I think the long-term plan with the way that it's being explained is really a great vehicle for us to use. I think it's a bold plan, and it's going to take a lot to make it happen, but it's there. So I think it's something that nurses want to do. Now, of course, it's not without its challenges, because it's time, pressure, targets. I'm not even going to mention staffing levels, and there are so many other things that are going on. So I think the will is there, because we all came into a caring profession, whether that's nursing, medicine, or any of the other professions, to do right for our patients. And I think now is the time that we really can, because there's never been a better time, I think, to try and join it up and do the best we can.
Thank you, Michaela. I'd also like to ask you a second question, because I know in your role at C3 Collaborating for Health over the past year, you've become the nursing profession's leading spokesperson, really, on obesity in the profession.
Yeah.
And you've developed a wonderful app to help nurses manage their weight. And as you've been doing that work, do you think there are parallels between how nurses manage their own physical and mental health and that of their patients?
Absolutely, Tom. And yeah, so I joined C3 about 3 years ago with a project called Win the Healthy Weight Initiative for Nurses, and it was a really a bold project that nobody wanted to touch, you know, talking about weight in nurses and how dare we and all that sort of stuff. But, you know, as nurses, we are so important. We should, cobblers' children, we should look after ourselves more. We really should. So the vehicle that we were using, first of all, was weight, because that was the nature of how the funding came along and stuff. You had to work within that. But I don't think we could just work with weight in isolation, because there were so many bits that are involved to it. So I think when we spent a lot of time, years I've spent engaging with nurses talking about weight, but I can't do that without acknowledging that there is lots of other bits that go on. So nurses saying, well, actually, how could I possibly look after myself, because I'm at work all day, I go home, I've got the kids, then I've got my parents, I'm back at work the next morning. You know, there really is so many other things. But I do think that nurses, we have to step up. And we have to look after ourselves. We have to say, I am important. I'm important for me, but I'm important for my patients. Because if I want to do the best I can for my patients, I need to be the healthiest I can. So I think there's also something about being a, dare I say it, a role model. You know, and we could go into that, and I could spend hours talking about that, but I think we also have to work for as long as we can do. So as you rightly said, Tom, it's right, I'm normally in bed by now. So, sorry, that the app Nursing You came from the nurses themselves.
Yeah.
So we, through focus groups, nurses said, you know, we are different, we are special, no one understands us like us. And that's where it came from. It started off as a very clunky interactive PDF, and now it's an app, and we're supported by that through Maximus, which is wonderful in making it happen. It is for all nurses that are out there, and yes, there's weight and weight management involved, and actually we have health coaching for now, so a 12-week health coaching programme for nurses, run by nurses themselves, so we really are trying to keep it by nurses for nurses. So yeah, it's free, and it's for anybody that wants it, and I'm sure we'll be able to put some information out about it later, but it's there.
Thank you very much, Michaela. All of you have set out in different ways what we need to do to make mental health and mental health awareness a greater priority, both from a patient perspective and from a nursing perspective. It makes sense, there's a strong evidence base for it, and we know, if we look at what the NHS has done this year around the issue of sepsis, which again was a significant problem in the service, we know that we've been able to address sepsis and to create much better patient outcomes as a result of that. So how do we do the same with mental health and mental health awareness as we've done with sepsis? And maybe I could start with you, Jocelyn. At the Point of Care Foundation, how have you managed to get organisations and managers in organisations to sign up to Schwartz rounds or to looking at that emotional labour of what goes on in hospitals and healthcare settings?
Schwartz rounds is one of the few things in my life that I've been involved with which have been, like we've been dragged along by the demand, actually. I think there is a real appreciation inside the service of the need, and therefore people who have experienced being in a Schwartz round in one organisation and then moved to another have really championed them and said, I want to do this here. And they could be a nurse or a doctor or an AHP or a manager, any of those kind of roles. Usually in the middle of organisations, not very senior. And our job has been to help them work out how they can work up their organisations to get people at more senior levels to champion them.
And use their voice in that organisation.
Yes, yes. So we've done it partly by providing those champions with lots of information, very clear, PowerPoint presentations they can show to the executives and so on. There's no question that we were helped by the Francis report, that the impact of the Francis report immediately and for a few years afterwards meant that NHS trust boards were very seriously prioritising both patients' experience, and many of them were open to a concern about staff and to the evidence on the importance of staff wellbeing as well. We worked pretty hard to get the national agencies understanding that the RANs were a contribution to wellbeing, so CQC has commended organisations in their reports for doing them, for example. And then otherwise I think it's a combination of trying to disseminate the evidence as, in as many places as we can, and also to tell the stories that come out of rounds, which are so powerful that if you read an account of attending a Schwartz round, there was a blog in the BMJ last week about, just written by somebody who'd attended two, one in a hospice, one in a hospital, and they sort of speak for themselves really. So I think deep down it's the power of storytelling that really matters.
Thank you. Steve, come back to you, full circle. In many ways your report has been the architect of so many of the things that we've been hearing about this evening. 10 years on, your health and wellbeing review remains the benchmark, and it remains the call to arms in a sense to do something different in the service. And it's been the most robust call for us to do that, and it's founded on the huge waste that goes on in the service. I think it's 4 million nursing work days a year are lost to mental health related, stress related conditions. So it's a huge resource that we can ill afford to lose really from the service. We've heard about some of the changes like the Schwartz rounds that Justin's just been talking to us about that have happened over the past 10 years.
Which are excellent.
Yeah.
Absolutely excellent.
And are there further changes, Steve, that you'd hope to see happen in the NHS over the coming years in relation to taking this work forward?
Yes, I think sadly 10 years on, all the progress has been made. There's still an awful lot to be done. And it's sad in a way that the review, some of the points in the review still remain very current and still unimplemented. And I think there are things that need to be done at a system-wide level. So there are things like making genuine culture change in the organisation to create workplaces that are health promoting rather than health destroying at the end of the day. So we have to think about whether the way in which we're organising the work, the vacancy levels that we're carrying at the moment, for example, the work demands actually are the best thing for good patient care. I think at both a system level and then at a local level, we have to recognise that investing in staff in terms of looking after their health is genuinely an investment and not a cost.
Yeah.
Having good quality support programmes in place and communicating those programmes so that people are able to access them and to use them, and actually it's okay to use those programmes rather than being something that actually is stigmatising at the end of the day, is hugely important. And then I think you come right down to an individual level. And I think it's unacceptable that we don't have in core training how to look after yourself and how best to use services at the moment, and that is still, I believe, true. of basic training. So I think healthcare practitioners should be trained to look after themselves. When you get on an aircraft and you hear the safety announcement, fit your own oxygen mask first before you try and help somebody else. Actually, we take that for granted, but the same is true of mental health and nurses. They need to start fitting their own oxygen mask.
Yeah.
Absolutely.
I feel like clapping for that.
I think we all use that analogy. I think one of the things that one of the people with lived experience, Hannah, who helped us with the Parity of Esteem report and also with the programme that we are developing, she really highlighted for me that she said, quoted as somebody that she'd worked with in the past, and talked about that nurses are not 100% well, and service users are not 100% ill.
Yes.
And I think that's the commonality that we have to be, and thinking about how do we balance our compassion fatigue. I think one of the things that was really raised for me with being involved in the Parity of Esteem programme is that actually equality and inequality runs really deep, right the way through. All the work that Yvonne's been doing, all the work that we are, you really start to hear the narrative of just how inequality is seeping through every single element. It's like a sort of wrapping an onion, and as the, you know, it's not just about the discrimination that we can feel in the staff, but we can feel it in our service users. I mean, that we know that the Mental Health Act, for example, is being implemented far more with people with severe mental health problems who also come from a BME background. And it's, you know, I find it extremely difficult as a practicing general and mental health nurse when I hear those narratives, and I hear people, you know, wanting to leave the profession because they can't make the difference that they thought they were. But what I do think is really refreshing is the fact that we're having this conversation. I just think that is fantastic. That's where I would see 10 years on. 10 years ago, we wouldn't be sitting here.
It's good to see that there's increased awareness and these conversations need to take place.
Absolutely, without a doubt.
Thank you. Yvonne, as Steve was speaking about that 10-year task, 10 years since the Health and Wellbeing Review, it did remind me of your work on race equality that you've been plugging away at, probably for almost the same length of time now.
Indeed.
And you look better on it.
And it is hard to get these changes into the service.
It is.
Is there anything that you'd say to nurses watching the webinar in terms of the role that they can play as a change agent in making things happen?
Yes, I think it's a tricky one, and it is definitely tricky, because what we know is that the system that we are working with has been developed perfectly to give us exactly what we have. And for many, many years, the system has been all about delivery. It's all been about targets. And hard targets as well. So people have been, the system has helped people to see that, or to behave in a way that gives us the outcomes that we've got. And I remember back in 2009 reading the wonderful report that Steve did, and I was actually thinking to myself, my goodness, this is really interesting stuff, because what we're doing now is linking how patients, the outcomes for patients are as a consequence of how staff are, their well-being, and how staff are. And we know that staff in our health services are more stressed than there are else in other public sector organisations because of the work that they do. And as I already said, black and ethnic minority staff are in that place as well. And I think that you can't talk about the issues that I work with without talking about the wider issues that we have in our country and globally around inequalities and race inequality particularly, because we know that it's a worldwide issue, and we talk about 10 years, but this thing that we're trying to unpick has been in the making for over 200 years. So, you know, people's thinking about others and what's different is ingrained. It's ingrained in our society, and it's ingrained in every single one of us. So 10 years is a very short space of time in order to make the changes that we need to make, and particularly, as Steve has said, looking at cultural change within an organisation the size of the NHS. It's taken time to get people to understand and actually to believe that the things that Steve had written were absolutely the truth, that actually the impact on patients was down to how staff were interacting with them and what staff were feeling themselves. I don't think about 10, 15 years ago people believed that. I don't think it was something that, because we didn't have the evidence that showed that that was the case. But what we do know now is that it's absolutely the case, and other colleagues that Steve told me earlier that he worked with, Michael West and Jeremy Dawson, they've done lots of work on looking at exactly that. And I remember a piece of work that Jeremy did recently stating that, you know, you can save £1.7 million in an organisation very, very easily just by engaging better with all of your staff. And so we know that engaging with all staff is really important, but engaging with your black and ethnic minority staff is just as important, if not a little bit more important, because what we do know is that there are more hands-on clinicians. So in London, for example, we have what we call a majority-minority nursing population. We have 27,500 nurses from black and minority ethnic backgrounds and 25,000 white nurses. So we know that we have to, and a lot of those nurses are at band 5, band 6, hands-on patients. Similarly with our doctors, we know that we have 45% of our doctor workforce are from those backgrounds, and indeed the majority are doctors with hands-on patients. So we need to make sure that those individuals are valued, appreciated, and have equal opportunities within our NHS so that they give the patients the care that they need. So in order for that to happen, organisations have got to change the cultures within them to make sure that there's fairness, equity, value and respect for absolutely everyone, so that people aren't feeling disenfranchised and demotivated and that you know, this place is not doing anything for me, so why am I going to bother? Because if we're not cared for, we don't care as much. So I think it's really important that we focus on that. And I think that the work that I'm doing is beginning to have traction.
Yeah.
I think we are in a place where it's been acknowledged that there is an issue around making sure that we treat all of our staff well. We're building it into the long-term plan, we're building it into the new people plan that's coming, into the standard operational framework, that we focus on culture and compassionate leadership and making sure that all of our staff, including our BME staff, are treated with dignity and respect. So I think that we're getting there slowly but surely. But it's going to take much longer, and for many more nurses particularly, to understand these issues, because they are instrumental in making the changes that we need to make in order to have a fair and equitable health service.
Thank you, Yvonne.
So that's a clap.
We've now got a chance quickly to take a couple of questions from those of you that have been watching the webinar at home. Thank you very much for the questions that have come in. Our first question is from Joanna, who's a practice nurse in Uxbridge. Thank you for making me more aware of mental health workplace needs. This is not an area I've had much training on. Do you have any suggestions? Catherine, maybe I can come to you as one of our Royal College of Nursing spokespeople tonight. Do you have any suggestions, or could you make Joanna aware of any RCN learning resources that she might find helpful?
Yes, I'm delighted that through our working with our learning and practice development colleagues that we have started to, in the development stage anyway, a mental and physical health module, which will be people will be able to attend that or have sort of the opportunities to really polish their skills in both areas. And also that we have got through our Parity of Esteem website and through our open RCN clinical topic website, we have now got greater opportunity to share some of the good practices, and we've also outlined them in the latest report, so people can look at that and they can come to us and sharing different examples. So across the country I'm now much more aware of different really good practice examples, and so we are very able to point people into the right direction and to say, well, share from this, and there is an emerging group of people who are starting to say actually parity of esteem is the way ahead, and we are in October going to have a big launch of it in relation to, our hashtag is going to be making parity reality. We think it's rather lovely.
Thank you very much.
Yes.
Steve, did you want to add something?
Yeah, I mean, I think it may also be worth mentioning that NHS England and now NHS Improvement and NHS employers have spent the last 2 or 3 years developing a staff health and wellbeing framework, which is there and has got some absolutely excellent resources there that can be used both by individuals and by organisations in terms of actually addressing some of the issues in this area.
And thank you for making our people who are watching the webinar aware of that. Thank you, Steve. I've got another question. Looks like a rather sad one. Sometimes I go through a roller coaster of emotions every day at work, and I take this home with me, and my partner gets fed up with hearing about it. Yvonne, as ASEAN Deputy President, do you have any suggestions?
Yes. I mean, I think that as a nurse, this is something that happens quite a lot. I think when you go off your shift or you finish doing what you're doing, and you carry sometimes some of the weight of what you've seen and what you've done with you, and I think that that's really difficult. I think the key thing with this is to talk. I think having some of that bottled up inside you can make you feel really depressed and quite low, actually. And I know that talking to people, talking to others, talking to your colleagues, talking to your husband, talking to the cat, the dog, whoever it is really is helpful to actually be able to offload some of the things that we carry around. And as nurses, you know, that can feel quite heavy sometimes. And the RCN are a wonderful organisation, and we have a counselling service which people can access. So, you know, I have the telephone number here, 0345 772 6100. I'll say that again, people. It's 0345 772 6100. And I think that if people need to talk to your manager, talk to your line manager, talk to anybody who will listen and say, you know, I need help here. And I think that sometimes people feel that they don't want to ask for help because they're supposed to be strong, they're supposed to be able to carry, you know, the weight of the world on their shoulders, but all of us have times in our lives when we need to offload onto other people and have other people help us.
Yeah. And we shouldn't forget that it's not just about taking issues home from work. Nurses are no different to any other.
The other way around as well.
And actually they have issues from home that they bring to work with impact on their patients.
Absolutely right.
I would say to also to this person who's is also, you know, don't underestimate the use of social media. I am now on Twitter and I use social media, and I have noticed that the amount of support that people are giving when they're having these sort of experiences, and just say, you know, that it's lovely to hear people, and just even to have that to support each other. And I know that there are some, you know, we have mental health nurses. We also there's a lovely student nurse project stuff. So it is really worth thinking about using social media as well. But also, if you can't talk to your employer, Yvonne is absolutely right. I think the network of mates and peers and professional support is absolutely imperative, and that's the first step. Is to saying actually this doesn't feel, and you'll be so surprised just how many other people will say I agree with you.
And don't be afraid to say to a colleague, are you okay?
Yeah,
absolutely.
Yeah.
Can I jump in?
That's a really important point. I'm afraid we're out of time. So I just need to wind up the webinar. There's a few things that I'd like to say. I think it's become really clear this evening that getting it right for nurses is just the same as getting it right for patients. We really need to think about both the physical and the psychological aspects that are working in those different scenarios. Steve, you've noted that the NHS workplace should be a primary site for mental health promotion and prevention. We hope that's come across really clearly to you all this evening. If your workplace and your manager already take this on as part of them being a good employer, then that is absolutely fantastic. If that doesn't happen where you work, we hope that this webinar tonight will give you some pointers to help you talk about the way things maybe could change for the better in your own workplace. I'd like to thank our speakers. You've been magnificent tonight, all of you. Thank you very much. I'd like to thank everybody at Pfizer for funding the webinar, and I'd like to thank those of you at home for joining us tonight. Good night.
Thank you.
Thank you.
Good night.
Bye.
Bye.